All right, well, let's get going then. Robin Schofield, thank you so much for stopping by.
You're welcome.
I've got a lot of questions. I'm really curious. The Associate Director of Clinical and Sports Psychological Services for Athletics here at USC. And you said you've been here 22 years, 23?
22.
22. So tell me a little bit about what you do.
So I'm the head of the program, but the sports psych staff includes 3 other full-time clinical sports psychologists, a postdoctoral fellow, and a part-time sports psychiatrist. And we sort of run the gamut from helping student athletes manage, and the department manage emergencies and crises around mental health and health, all the way to the other end, which is, help them with individual and team performance. So in the middle is, more mild mental health issues. General student athletes are subjected to those at roughly the same rate that our college student population is, to just personal issues, to wanting self-improvement, to wanting to know how to get along better with their coach or manage as team captains, or, just strictly perform better. And then, so we handle all those kinds of issues, as well as work with teams and coaches and the administration on just providing an environment that's conducive to well-being and excellence. Those
Right.
things aren't in opposition of each other. So we're trying to support both.
That's really interesting. So is it you're really offering the full gamut of psychological and mental health services, but it just happens to be for athletes?
Yes. And, adding to that,
Team dynamics.
Teamwork, and also sort of a more hands-on approach to helping coaches and the department manage folks with more challenging mental health issues, and then just the performance enhancement work in and of itself.
Right. So way back in the day, 22 years ago, what was it like?
When I first came here.
Yeah.
So, the sports psychology science has been around for a little bit. It's a tough science because there are so many factors that contribute to any particular performance that it's very hard to isolate, factors that contribute to performance. But sports science has been around for a long time. And of course, mental health issues have been around for a long time. So when I first got here, the field was starting to get some traction. And you were starting to hear in the media, in the general media, a little bit about elite athletes who were using sports psychologists. But then, we largely followed the collegiate trajectory of mental health issues in and of themselves, steadily rising over the last 2 years amongst the collegiate population. So when you pair that and the student athlete,
Hold on. So 2 years ago is when everything took off. Is that what I'm hearing?
No. This change in trajectory started about 20 years ago.
Uh-huh.
Yeah, where gradually, if you look at the ACHA, NCHA data, which is kind of the gold standard for the top 200 universities in the country, the mental health issues slowly started creeping up.
Okay.
And over the last couple decades, and especially the last decade, it's been well documented in the media that mental health issues have been significantly on the rise in terms of number of symptoms and severity of symptoms for collegiate students in general. And basically, the student athlete population has had a similar steady increase as well. So from our millennial generations to this generation, we've had young folks who are more resourceful. They're good at seeking out help. And so, and increasingly, as more and more, elite athletes have talked about getting psychological help or seeking, the support of sports psychologists, it's become slowly more and more acceptable. So there's a lot of factors that have contributed to sort of the current zeitgeist, which is that, it's become very acceptable. And so I think for a variety of reasons, the discipline is just exploded now.
So you're saying there's all those different factors, right? It's destigmatized. More people are feeling comfortable to be treated, and there's also more people who need treatment. How do you look at those? Do you think it's 50-50? Where do you put the split? Do you think it's more that people want or are, that treatment's acceptable and that people always needed the treatment, or do you really think that there has been some societal breakdown or some serious increase in mental health issues that we didn't see in the past?
I don't know that I could break it down by percentage.
Sure.
Because, societally, you're asking, what were these rates of depression there before, and we just didn't pay attention to them. We didn't measure them. We didn't talk about them because of the stigma. Definitely a possibility and probably a contributing factor. Do generational and cultural factors affect the changes that we see? Absolutely, no question. And then also just, the idea that we should be working on our mindset and mental skills like we work on our body has also, sort of risen. That idea has become more acceptable within athletics, right? So if you think about, so you've got multiple contributing factors. If you think about
when did it start to become more acceptable?
Well, here it's been acceptable for a long time because, I've been here a long time. So that just afforded a certain amount of stability in the relationships. And, I was able to work closely with the coaches so they know exactly what the approaches are. We translate into layman's terms what actually happens in a session. So there's no guessing. What do we do if this athlete comes in and wants to retire? What do we do if athlete comes in and they're burned out? What do we do, if they're having relationship problems? What do they do if, they're having any kind of existential crisis about their sport?
Right.
Whatever. So we're very open about how we actually work. So that gives coaches a lot of comfort. And then we work with coaches to help them manage what can be challenging situations for them to manage just with their relationship with the student athlete and the effect that it has on the team.
Yeah.
So as we've done more and more of that, they become more and more comfortable with what it means. Because if you think of athletic culture, right? Athletic culture is about things like where there's a will, there's a way, right? Which means that if anything's wrong, from a broken leg to, disappointment, your will should be able to fix it. And, we know there's limits to willing a broken leg without a cast. And similarly, there's limits to dealing with some mental health problems without some guidance.
Right.
And so, but historically, that sort of stoic athlete persona and, the stigma has sort of precluded athletes from coming in. But as we've been able to work more openly about how we work and what we do and what facilitates change, coaches have been more and more comfortable. So all of our coaches are completely comfortable, refer in, are happy to kind of stand next to us in front of the team and endorse the services.
Okay, Robin. So I'm coming into the office. I'm the star quarterback at USC, and I say I want to retire. And you're saying that Coach Helton's I tell Coach Helton that, and he's gonna refer me to you.
I mean, he may have some things to say about it himself,
right?
But then another option is to refer him into us as well, to open the dialogue and give the person the space to kind of work through, what brought this on, what are they thinking about. A lot of times when there are those kinds of issues, there are other things that they're not satisfied with with regard to their sport. And it really has to do, a lot of it has to do with the difference between a childhood athletic career and adult athletic career,
Right.
elite athletic career, and adjusting. And people don't know how to shepherd athletes through that transition. And that can create a lot of challenges for them. So, generally we recommend that this a safe place be provided for them to kind of think through their thoughts and sort of try to really understand what it is that's creating this, unsettledness within them, rather than making some kind of rash decision.
Right.
Most D1 student athletes that come to, compete at D1 level, they made a right choice. They did it because that's what they wanted to do. But there are a lot of things today that can kind of challenge, the experience they've had in athletics before they get to college to the experience, what it's like once they get to college. So sometimes they just need support in making that adjustment.
Yeah. That's interesting. And you talked about earlier the increase in, well, we can't put a percentage on it, you said, between people, the destigmatization, people feeling comfortable talking about it, and possibly the rise in the issue of mental health problems. Have you seen personally a rise in treatment at USC for mental health issues?
Absolutely, which is why I started out, part-time here myself, and now there's 4 full-time clinical sports psychologists, a part-time sports psychiatrist, and a postdoc. So yes, and across the country, if you look at it, that's the tidal wave of the movement, is that universities, and this isn't, again, this particular statistic, it's not necessarily specific to athletics. Universities across the country are struggling to accommodate the demand and severe increase in demand in general counseling centers on campuses.
Sure. And why is it that the university allocates, would the sports psychologist see the athlete for a mental health problem, or would it be the psychiatrist? I don't know the difference.
Psychologists do the talk therapy, and psychiatrists primarily prescribe medication. So that's why we have 4 psychologists and only 1 part-time psychiatrist. It's the minority of folks who come in for psychological services want psychiatric services, which is prescriptions.
Mm-hmm. And these sports psychologists are allocated to the athletes instead of just general practicing psychologists, because they know the stress an athlete faces.
Well, they've been
trained on the stress of a sport,
in the culture of athletics, in how to intervene, how symptoms manifest slightly differently in athletes, the intersection of sport performance and mental health issues. They've been trained specifically to work with this population, just like any other sociodemographic population. And athletics at USC was one of the first to really recognize the significance of the issues of the whole person. So, the administration realized many years ago that one of the biggest factors really that get in the way of sport performance and academic performance are personal and mental health issues.
And you got here what year?
1998.
Okay, and what year did Pete Carroll get here?
He was here in the early 2000s.
Okay, and I know that Pete is at least seemingly a proponent of a lot of this stuff. Did you work closely with Pete?
Not as closely with him when he was here.
Okay.
He had a master's degree in psychology,
right,
and sort of had his own philosophy. He would refer in, as needed. But he's kind of worked more closely with sports psychologists since he's left.
Right.
Yeah.
And there's that famous, there's that tennis book. I can't remember what it is. It's
the inner
game of tennis.
Yes,
right.
Yes.
Right. And he's
That's
friends with
one.
the person who wrote that. Okay.
Mm-hmm. There's a lot.
I didn't know if there was a connection there or something. So this is actually kind of complicated. I'm realizing there's a lot of different things you do, and it's been nice of you to kind of overlay it in a few different sentences, like we do this team thing, but I want people to actually be able to understand what that means. So I think we kind of hit and cover the what the sports psychologist is doing if the athlete is struggling with a mental health issue.
Right. So we would see them for individual sessions. If it was extreme or needed more support, they'd get referred to the sports psychiatrist for medication. But again, the vast majority are not referred for medication.
Right.
We also, if there's a mental health emergency or crisis, we are involved. If it got to the point of having to do hospitalizations or needing a higher level of care.
Is there ever a time where you recommend that they should take a break from the team?
Yes, it's rare. I mean,
Okay.
just because that level of severity is more rare.
But it's happened.
Absolutely.
Mm-hmm.
Absolutely. Yeah.
So then that's really interesting on the treatment side. Now there's also this whole performance side.
Right.
Do those things get all mishmashed together in the same session? Are they completely different things?
So our approach is the whole healthy person is the best and most consistent performer, whether that's, being a good person, being a good student, or being a good athlete. So the premise for that is that a lot of the skills that you use in managing peak performance are actually very similar to the skills that you use to manage your mental health and vice versa. So there's some perspective issues that need to be addressed depending on whether it's a performance issue or a mental health issue, but the skills you learn to cope are very similar. So when you learn one, you can apply them to the other. Does that make sense?
That does.
So there's an upside no matter what you come in with. But that's been the department's approach. That's our approach. So, and it's one of the reasons we always hire a licensed psychologist is because they consider the whole human being, not just this small slice of who they are, which is athletics and their peak performance. So there are people who specialize in just that. But we focus on the whole person. And part of the reason for that is, do you think, for example, that for our average student athlete here at USC, that their athletic performance affects how they feel about themselves?
Yes.
Yeah. Do you think it affects their identity?
Absolutely.
Right. And what's your identity?
Athlete, then student. Athlete dash student, not student dash athlete.
Well, you are actually right that when you look at elite athletes and you look at their identity, we have many identities, right? Son, brother, sister, gender-based, racial, ethnic, religious-based identities, community identities, intellectual identities. We have a multitude of identities that make up how we see ourselves. And among elite athletes, the similarity is that most of them identify primarily as athletes. So that has to do with the core of who you think you are and your purpose. So mental health issues are related to the core of who you are and your purpose.
Mm-hmm.
So it would make sense that if you're going to be dealing with mental health issues or performance issues, that you understand they affect the core of who you are.
Right. What's confusing about that is that you've said there's been this uptick in mental health problems, but you've also said the core is that I'm an athlete. So why has there been an uptick in problems when the core identity issue hasn't changed? They're still student athletes like they were in the 90s when you got here, and that was their core issue and focus. So is it these things outside of that shape the core?
Absolutely. And how the core got defined, right?
It's changed.
Yes. So even though elite athletes have long, prioritize their athletic identity, at least while they're doing their sport, as their identity as that of an athlete. So remember that the uptick in mental health issues is across the board. That's not unique to student athletes. So
Of
student
course.
athletes
Yep.
are being affected by our culture, and however they're internalizing who they are and what's important, just the same as our non-athletes. Now, the other piece with regard to the performance side, so elite athletes have always wanted to perform well, right? But when you have a core that is grounded in all of whom you are, and you're having to manage ups and downs, and you're having to have the freedom to move into a flow state and let go, you have to know who that core is, and it can't be threatened every time you get up on a block or you're starting on a field or a court. It has to sustain the ups and downs. So if you take a desire to achieve and you or the pursuit of excellence in a culture that has largely in the last few decades focused on self-worth through achievement rather than through character, that puts additional pressure on the student athlete. So the idea of achieving and pursuing excellence no longer becomes an endeavor by which we develop our character and our personhood. It becomes a thing that determines whether we're worthy or not.
Okay.
And that makes athletics a threat rather than a challenge.
That's interesting. Let's bring social media into this, because there may be something here, but there may not be. But social media seems to define, I still see that achievement's a big issue there, but athletics isn't necessarily the top for athletes. I follow athletes, and they're not always posting their athletic achievements. Especially with women and men, I've noticed that some of them are posting more achievements of their fashion or how they look or their material success or where they've traveled, because that shows more worth through achievement than the athletic performance does. Have you noticed that?
That's a pretty lofty thing to say. So you're saying how they dress and where they travel and what they eat is now more important than their athletic endeavor?
The athletics seems more a means to an end for some of these athletes. For
some, it is.
I'm not
right?
saying for all. I'm saying I've noticed by some social media accounts that I follow of some athletes that appears to be.
Some get to a certain point and feel like to expand their brand, they're going to do things that are well within their control, right? Whether it's eating certain things, wearing certain things,
Sure.
Those kinds of things. The athletic endeavor and success in the athletic endeavor is not entirely within an athlete's control, right? Because you cannot control a competitor. So, if you got to a certain level and you maybe recognize that, it might be, just easier to expand your brand through things that you can control. But I would suggest you're probably more of an expert on this than I am, since I'm not an expert on social media.
But I think you should track the social media closely, because that has to be at least a stressor for your athletes that you
I think it
treat
very much
and
is.
take care of.
I think it's very much is. I mean, in the last 15 years, 10 years, we've had people come in with depression, but this isn't exclusive to student athletes because they didn't get enough likes. Manifesting symptoms of depression, not because of their real social life and the real human contacts they have and the support they have, but because of what's happening on their social media accounts.
And see, to me, that is saying that the competition for achievement on the social platform is usurping the competition and core identity in terms of athletics.
Well, I mean, that may be what it's messaging to you. I
don't know what you think.
I'm
just throwing that out there.
I mean, how long do you think that's going to last without the athletic side to it? How long do you think, like, the life of that, the focus on what they wear, what, travel, that kind of thing, Without the athletic part behind them, how long do you think that's going to last?
Well, it's interesting because I follow this tennis star named Eugenie Bouchard, and maybe 5 or 6 years ago, she made the finals of Wimbledon, and now she's in challengers on the future circuit, and her social media brand's only grown, not
Because of her tennis
not
success.
because of her tennis success,
Yeah. And
because of other things like her looks or her.
Well, and that can happen, right? A lot of folks want to get into broadcasting, but they hope to be an athletic success, and then they can become an analyst and then go from there. And I think young people have, a lot of them have been able to parlay their athletic, success at some level into other things. So I think you're going to, and if those things become more substantial, it makes sense that they're going to focus on those things. But, you know, probably for the average athlete, it's not going to parlay into an ongoing celebrity status without the athletic piece there.
Right. So then it's just becomes, do you look at social media then as more of a stressor than a value added? How do you look at it as a professional?
I don't know that I would. I don't necessarily feel I'm qualified to. I'm sure there's great things about it, and there are challenges about it. I do know that one of the unique things for student athletes is that when you grow up, you get your family values from your family, maybe your age group coaches, your high school coaches, people in authority in your community. That's the messaging for your values. When you leave home for the first time, you are integrating those values in a meaningful way by yourself.
Mm-hmm.
And you're challenging them and you're trying them out. And we all fumble in this process. You have to grow them. You usually need more than you come to school with. You need more coping. And this is a time of trying everything out in young adulthood and college. And if you're not a student athlete and you fumble, who notices?
Your parents when you're back at home.
Maybe.
At your house.
But you can fumble a lot and still stay in college too.
Sure. Yeah, not drop out.
You can make social mistakes. You can make all kinds of academic, relational, other mistakes, right? And for the most part, nobody's watching that much, right? As a student athlete, that's not the case. You are going to do all this fumbling, all this, trying out those values, all trying to use your old coping strategies, trying to learn more to deal with more and more issues that come across your life as you grow. But you get to do it all in public.
Mm-hmm.
If you don't do well on a math test, if your GPA isn't good, everyone in athletics knows. If you, make a mistake at a party and you're a non-student athlete, unless it crosses that barrier into judicial affairs, not a lot of people know, right? If you do on an athletic team, the coach is going to know, your whole team's going to know.
The stakes are much higher.
The public stakes are much higher. Your training is observed. Your competing's observed. If you're not making it academically, it's observed. So if you had a bad day and you're a regular student, you could go and say, it was a bad day. I'm going back to bed, pulling the covers over my head, skip class, and I'll regroup and start again tomorrow. A student athlete's got somebody knocking on their door saying, why aren't you at practice at 6? And by the way, if you miss your classes at the end of the day, your coach is likely to know and there'll be some consequences. So when they're fumbling around and trying to cope as a young adult and manage new adult responsibilities, it's very public. So it's much more challenging.
Do you
and
think
exhausting.
There's a point where the challenge becomes too challenging and it's counterproductive? Because in athletics, we talk a lot about recovery. And the latest thing in athletics is that the faster that I can recover, the more I can eliminate stressors, the better I can recover to train harder for my specific sport. But we've got all these crazy other stressors in college athletics. Just being at the university, the social influence, like going away from home for the first time, finding yourself. And this is an elite institution. I came from Cal Poly San Luis Obispo, where you had the same experience, but it was more relaxed as a student athlete. Is there a breaking point? Is there a point where it all becomes too intense and too much?
I think it's a case by case. So most of our student athletes, they consciously choose this level of intensity. You can choose a great student athlete experience at a D3 school, and you can choose a great student athlete experience at a D1 school, but the intensity is not going to be the same. So most of them, choose this because this is what they want. Does it become overwhelming for some? Yes. And, when we talk to our student athletes and train them around coping, we talk to them about, because of the rigors of your schedule, because of all the demands on you, to be overwhelmed at least once a semester is the norm. How you manage that overwhelm is what's going to be important. If you're overwhelmed all the time, then you need to come in and we're going to help you out. So yes, a chronic state of overwhelm would not be a healthful situation. And for some people, that is going to be, the line is going to be different than for other people.
And would you say it's a rare case at USC where a student athlete in a high demanding sport is in a more challenging major? Or you say it's a case by case basis?
I'm sorry, it's a rare case that they're in
a demanding major? Or would you say it's a case by case basis? Because again,
I think it's case by case.
Yeah.
Yeah. I mean, do you think the Marshall School or Annenberg is challenging?
I think there's a lot of factors. I think it depends on where you are in the system, what type of classes you take, what types of things you choose to participate in. So I think that there's avenues for easier and harder paths within each school. So
I think the same would apply for our student athletes.
Right.
Yeah.
I'm just thinking because, if you take a step back from USC and you say, okay, Harvard's still D1, but they're not competing like the University of Southern California is competing in D1. Yeah. I'm just thinking from that way step back, like, okay, there are limits to what we can focus on, specialize on as human beings.
Yes. I mean, I think the student athlete lifestyle is possible. I think, like I said, you have to be better. You have to hone those coping skills. You have to develop that emotional tolerance. And, you have to be good at time management. That's why the Apples and the IBMs like to hire student athletes, because they hone a lot of these skills.
Right. And how do you think about Gavin Newsom signing the new bill that will allow student athletes to receive endorsements starting in 2023? Do you think that will make the student athlete experience easier, or do you think it'll make it more difficult?
I'm going to defer that question to people who are more experts about what the reverberations are going to be with regard to that bill. I think there's a lot of reverberations that we can't even anticipate yet. So.
Of course. I guess I would think in terms of what you specialize in, which would be mental health.
How that bill is going to affect the mental health of students. I think the bigger effect is going to be on the athletic department programs.
Right.
And whether we're going to be able to maintain the programs as they are, what they'll look like if they're, different, whether we're going to be able to have the same number of sports, the same number of athletes, So, yeah, I'm not as concerned right now about, we'll have to see what the new structures are before I can sort of anticipate what the
Definitely
health issues are.
Yeah. So going back to the sports psychiatrist, if I want to go for treatment, is it specifically to medicate, or do you have programs and offerings that are more meditation, mindfulness? I know there's those sensory deprivation tanks, things like that. Are those ever? I'm getting a laugh out of you for the sensory deprivation tank, but I haven't tried it, but I kind of want to. So,
So remember I said that the minority of people who come in are on medication.
yes.
So the vast majority of people who come in, whether it's for personal or mental health, most student athletes who come in are not, do not have a clinical diagnosis.
Right.
They come in to manage their lives better, to be better people, to be better students, to be better athletes, to be better sons, daughters, whatever it is. So that's the vast majority of people who come in to manage their lives better. So what was your question again?
Well, just you talked about medicating, and I was asking if there are treatments that you suggest that are outside of medication for athletes.
Only if there's a higher level of care. We provide the treatment. So the treatment may include mindfulness meditation, relaxation exercises. It may incorporate imagery. So these are all skills to help you cope. But they're just skills. The total array of things that we do, is the treatment. I think often there's a misunderstanding that mindfulness in and of itself is mental health treatment, and it isn't. It's one. It can be one component, but those skills are much more widely used than medication. So medication is really depending on what you've got going on. ADD is a little bit different than some of the other psychotropic medications, which really, folks only use, when it gets to a certain threshold. So.
In 98, you said you're part-time, and you're seeing roughly how many patients a week?
Back then, I don't know, maybe 20, 15, 20.
Yeah. And now you said you have a staff of 5, including you? Sports psychologist
we have
alone.
4 full-time sports psychologists, a postdoctoral fellow, and who's full-time, and a part-time psychiatrist. Yeah. And we're full.
And you're full. So you're seeing 100 plus patients a week then? If it's the same workload of 20, or is it even more?
No, it's probably the same.
So it's about 20 persons.
But it's for, again, remember, a variety of different things.
Of course.
But yeah.
I'm just trying to think of the scope of how things changed. And has the athletic program expanded as well? Are there more sports at USC?
We've added lacrosse and beach volleyball.
Okay, so the percentage is still up.
Yeah.
And then so for those teams like lacrosse and beach volleyball, what are the programs that you've developed over time in terms of
the teamwork?
Yeah.
So, the sports psychology came out of this positive psychology movement within the broader discipline of psychology. So, a lot of the, I don't know if you've heard about the wellness movement, well-being, that's very big now.
I haven't. I try to think of myself as a person that practices wellness, but what is it?
It comes also from the positive psychology sort of thread within psychology. But sports psychology has been practicing the things that have been, sort of the basics of positive psychology since its inception.
And when did positive psychology begin? Is that like way back, like Norman Van Peele and that stuff?
That is
like the power of positive.
Martin Seligman is one of the sort of grandfathers in this area. And so the teamwork has always been based on that, mission statements, value statements, goal setting, developing a healthy culture. There's a lot about athletics in and of itself and the structure that provides for the environment that generally is, fulfilling and supportive. There's a couple of areas that, athletics needs to, continue to work on. But there's connection, there's mastery, there's a lot of those foundational things that are very much a part of the athletic lifestyle and team experience. So we've been doing a lot of culture work in terms of establishing healthy cultures that not only support well-being but support excellence and performance since the beginning. Now and that moves on into sort of performance enhancement skills like pre-competition routines, imagery, self-talk, a lot of those basic kinds of performance enhancement skills. Right now we've been developing a values-based performance program to really kind of help solidify the culture on teams, and that we usually do out of season.
So what is this values-based thing?
It's basically, establishing your purpose through your values as a team, and then living your experience as a team based on the values that you chose.
So what are some values of one of the teams?
Accountability.
Accountability. And so I show up to practice on time. I'm accountable.
Correct.
Oh, I thought you were going to say no. It's much deeper than that.
It's actually very straightforward. It's just hard to live. And it's hard to live in a group. And it's hard to live amongst a population that's changing, a lot.
What are some of the most underrated values you've seen on successful teams?
Underrated?
Like humor.
Oh, I think humor is
connectedness.
always, connectedness is, it's really about your relational values, how you treat other people, respect, integrity, care, compassion for others, humility, all those things help your connectedness and your relationships and team cohesion.
Yeah.
And they also tend to be more fundamental to motivation. They last past your athletic endeavor into your other professional endeavors, into your family, into all aspects of who you are and how you live and what motivates you.
Because you learn to live and thrive that way.
Yes.
With those core values. So,
and then there's also sort of more performance values, which are the accountability, responsibility, punctuality, adaptability, cooperation. Those are what help you achieve.
So those are like fundamentals or classics, pillars you can think of. What are some, I was mentioning earlier, what are some that you think you've been surprised to find on the most successful teams you've worked with?
I don't
that
know
aren't
that
the
I've
classics.
been surprised.
Okay, not surprised. You're very smart, Robin. But what's one that's outside of the classics, the pillars of performance, that just because it's not a pillar of performance, it is essential to team success?
I think the ones that are most surprising to teams and
or to a layman,
individual student athletes are the moral value, relational values, the values that connect you to other people. So, for instance, how does respecting the guy who cleans the tennis courts or the woman who cleans the tennis courts relate to you succeeding as a tennis player? Those are the things that folks sometimes struggle with, but they do affect each other. How does treating a teammate with compassion affect performance? Those are the things that tend to challenge teams more. Can you be compassionate and hold a teammate accountable? These are harder values. When teams experience those moral and ethical and relational values together, they hold the team together more closely. You have better team cohesion. I think it improves passion, commitment. But in our achievement-oriented society, and as things, what was the millennial generation was the first generation who was supposedly going to be challenged to earn as much, to live at the same standard of living as their parents.
Right.
Well, that got parent focus on the performance values pretty quick, right? You better be accountable, reliable, cooperative, adaptable, all those things that make you a great CEO, right? And so those, they're directly related to achievement. But without those, you have high achieving sociopaths.
Yeah.
And so you need both. And yet it's the very profoundly rewarding ones, the moral, ethical, and relational values that tend to be more rewarding, that sustain motivation and also support excellence. They're not in opposition to excellence.
Sustain mental health too, right?
They sustain well-being and mental health, because what has been associated, Americans have this eternal quest for happiness. And what's been associated with happiness? Not achievement, not wealth, not celebrity, relationships.
That's good. That's really good. So with the teams, I guess you're working on this values-based approach. What else are you working on with them?
We do things like conflict management, communication, goal setting. We have a lot of different modules we do,
Sure.
and then it moves into more specific things around performance skills. Like the imagery, pre-competition routines, managing your emotional arousal around, your sport, things like that.
Are you going to see Joker?
No.
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 Neither am I, but why are you not going to see it?
I'm not one for, violent movies and psychological thrillers.
A psychological thriller? I don't know, maybe a psychological tragedy, right?
I haven't seen it, so
Yeah.
I just, it doesn't sound like my kind of movie.
Right. I just came to mind because it's in the news, and we're talking about mental health, and people are saying that it's sort of a treatise on the effects of loneliness and the effects of people not
Yes,
paying,
I have heard that.
and the effect of loneliness and the effect of people who are right next door to each other not paying attention to or acknowledging one another.
Right.
Do you feel that as we've gone more away from familial, smaller communities, that you know who your neighbor is, that you have to teach those things to team, that coaches are having to teach those principles to teams? Or do you think that it falls easier into place for athletes because they know that bonding is part of team success?
I think it's a combination. So, my non-random sample of experience here, I would suggest that we have more students in general coming in with the performance values figured out and less with the moral, ethical, and relational values figured out. And which is the flip side of how it used to go.
Right.
You spent years and years on the moral and ethical and relational, and the performance one sort of evolved as you went into college and entered the professional world. And so those moral, ethical, and relational values are about how you connect with other people. They're not just about you. And so, yes, I'm not sure that you can wholly attribute it to the evolution from the nuclear family. I think you can attribute it to a lot of, connecting in ways other than in person.
Mm-hmm.
But I think it's really important. I think sometimes we do more community service than we've ever done before, which is a very good thing. But we forget that grace and compassion and empathy extend to the person in the office next to us, in the room next to us, in the seat next to us in class.
Right.
And,
It's like I want to go on the mission trip to Africa instead of knock on my next door neighbor's door and introduce myself.
Yes. And both are very worthwhile endeavors, right? Right.
And so I guess that's a kind of is the answer. It's a kind of.
I just don't think it's
with the
one
athletes.
thing that's leading to that.
Right. I just didn't know if athletes, because they're on teams, had to be taught more
Both. I
more
mean,
than in the past about this through
yes.
your teamwork building exercises and things
I mean,
you've
I
you've
think they
modules
have to
you've
be
developed.
taught more just in the same way that general college students need to be taught more to appreciate these things.
Right.
So they do have the convenience of seeing somebody 4 hours a day, every day, and coincidentally needing to have a lot of the same academic, sleep, travel schedules, eating schedules, right? So they have a tremendous amount of opportunity to be together, and that's what creates a familiarity that allows you to get closer to people. And that's the same everywhere. It's just the athletic environment. And that's what I was talking about when you're talking about well-being. That's one of the things that is automatically part of an athletic environment is the repetitive connectedness opportunities. But to make that connection a quality connection, you have to know how to relate to people well. You have to know how to respect people. You have to know how to have integrity and keep your word. You have to know how to be humble. Those things are what make for a quality bond with another person. So I think those things are things that everybody needs to work on.
That's good, Robin. I will leave it there. Thank you so much for coming on and talking with me.
You're welcome.
Learned a lot.